It is definitely a pleasure to be here, particularly speaking between, Dr. Brown and then Dr. Camlet, although in another room. My background is I just graduated from my psychiatric residency at University of New Mexico. I've previously done some MDMA research at University of Chicago, and Dr. Brown and I are currently working on quantifying the psychoactive effects of Ibogaine and in relation to their clinical outcomes. But today for the presentation, I'm going to talk about something a little bit more personal. I'm going to talk about Bwiti initiations and their relation to Ibogaine treatments for substance use, and particularly finding identity in community and connectedness. So the first day after my psychiatric residency, I left for Gabon, which is in central Western Africa. And the photo on the left is actually courtesy of a friend of mine who works in the national parks and sent it to me as a day at the office. It's about 88% jungle, and it's the home of the Bwiti, and it's the home of Iboga, with a group. With a kind of a small group of people, we went through both Cameroon and Gabon and went to maybe 6 different Bwiti sites, saw 3 different initiations, saw a healing, saw another couple ceremonies. One was blessing and a couple celebrations. And I think the one thing in every single site we went to was this sort of brilliant and vibrant sense of community that came across. And so I'm going to show you some pictures from the different sites. Here's us taking part in an initiation that was Fang, part of the Fang tradition in Cameroon. This is also Fang. This is an initiate in the Mitsogo tradition, which is women's lineage. Here as well. And this is the Babongo, which we're going to look at sort of the very roots of where the Bwiti come from. They come from some of the pygmy tribes in Gabon, and we were lucky enough to participate in a ceremony with the Babongo. And here are some of the pictures from this. Again, I've spent some time observing in Ibogaine clinics in the West for substance use and substance use treatment. And it's a pretty big difference when you look at the difference in the ceremonies. In the West, your eyes are covered, you're listening to headphones. Hopefully there's medical monitoring. Someone may be coming in and out. Sometimes people will speak, but usually you're sort of left on your own with monitoring. Whereas in the Bwiti, the initiates are never left alone. And there's always community surrounding them, supporting them. Here's a number of pictures of initiates. And the initiation ceremonies involve active participation of the entire community. Everybody is dancing. Is that a little better? Yeah. It's highly active. Everybody's dancing. There's lots of music. There's all sorts of instruments, including the harp, which you can see in the middle. There's a magongo, which is a stringed instrument. And even if you go back and look, a lot of people wear sort of shakers, and even when they dance, they have different things that make noise on their bodies, so their dancing becomes part of the music. The other thing when it comes to community in this is the ceremonies themselves have a call and response aspect that I found stunning, which is while you're taking place in the ceremony, you're always welcome to call out because someone will always respond. And the idea is even whether you're being initiated or whether you're part of the ceremony, you're never alone. You're always part of this community. I was lucky enough to get a chance to speak to Nganga, or one of the women who just gives Ibogaine, one of the women healers. And I asked her that if I was ever in this situation exactly where I was speaking to a room full of people from the West, what would she like people to know about the Bwiti? And what would she like people to know about initiation? And what she said really struck me, and is that the purpose of initiation is to know yourself. And especially kind of looking at the Western context and this sort of community context, it got me thinking, what does she really mean by know yourself? And, the sense of self is developed in a social and cultural context. People do not exist in isolation, and culture kind of gives meaning to the personal and collective experience. So, the concept of an experience of the self differs across cultures at really, really basic processes, like how do you define yourself? How do you understand yourself? How do you represent yourself? What do you value? What are your goals? In the West, we're very individually oriented, and we have a core value of sort of independent achievement. So the self is conceptualized as this unique person, defined by your history, your accomplishments, independence, achievements, self-reliance, materialism are generally valued. And each person pursues their own goals, and often it's in competition with others. When you look at the Bwiti self concept, it's very relationally oriented, and there's a core value of connectedness and interdependence. So the self is defined and understood by the relation to your family, to the community, to the society, to ancestors, and to the spirits. And so the self, therefore, isn't separate, but it's part of this interdependent communal system. And your value then is placed on your connectedness and your involvement in the community. Your goals are often sort of community-based. Here's just a sort of a more visual representation with the independent self-schema kind of the West, where, even within sort of your in-group, your family, your friends, you're still sort of separate. You still have your own individual goals. Whereas if you kind of look on the right, you see the interdependent, where your goals and your idea of self overlaps a little more with your family, with your friends, with your community. I think Malidoma Some, who's a Dagara, which is also Western Africa, but a different tribe than the Bwiti, says it very well. And he says, without a community, you cannot be yourself. The community is where we draw the strength needed to effect changes inside of us. Community is formed each time more than one person meets for a purpose. Development of community depends on what the people involved consent to. What one acknowledges in the formation of the community is the possibility of doing together what is impossible to do alone. And so what did she mean by know yourself? And I'm sure that I'm not getting all of it, but I think that she's not talking about their Western individualistic sense, but talking about knowing yourself in context as an interdependent part of the community. This bond between the self and the community is almost how that person can understand their individuality. And so how does this idea of finding this interconnected self relate to the use of Ibogaine in addiction in the West? And the Western concept of self is really moving away from that interdependence. There's a tendency to focus on the individual experience and actually exclude the social context. And people are sort of identifying more and more on the basis of material possessions. Higher focus on materialistic values like money, possession, status have been increasing. And that higher focus is associated with increased social isolation, decreased personal well-being, higher levels of anxiety, anger, depression, lower empathy, generosity, a lot of interpersonal relationships marked with jealousy. And when you look at Western culture and this increasing social isolation, the trends are showing that it is increasing. Both the quality and the quantity of the relationships are decreasing, and community involvement is decreasing. Social isolation is associated with increased mortality risk. It results in a decreased sense of meaning. And when you look at addiction and you kind of take a cultural theory or a socio-relational, you can start to see that addiction, one theory is that it's a psychological coping mechanism to this sort of increasingly isolating and social and cultural environment. There's a great quote by Peel and Brodsky, which is, "We are taught in many cases by the institution themselves that we need school, need marriage, need a steady job, need medicines. What we really need is to be whole in ourselves, to take charge of our own health and education and emotional development. We need to be confident that we can cope with, learn from, and enjoy the people and things that make up our environment, because that wholeness is so hard for us to achieve. Addiction is not, as we like to think, an aberration from our way of life. Addiction is our way of life. And so when you kind of think about it this way, from a more cultural or socio kind of relational aspect, you can look at addiction as a search for psychosocial integration. So that when people are separated from sources of psychological, spiritual, and social support, addiction itself can provide connection or a sense of belonging and even an identity. And I have another Johann Hari quote, which I love, which is, human beings have a deep need to bond and form connections. It's how we get our satisfaction. If we can't connect with each other, we will connect with anything we can find. The whir of a roulette wheel or the prick of a syringe. He says we should stop talking about addiction altogether and instead call it bonding. A heroin addict has bonded with heroin because she couldn't bond as fully with anything else. And the opposite of addiction isn't sobriety, it's connection. So recovery from addiction then involves much more than just stopping substances. It involves, a change of individual and social identity. There's a need to form an identity or refine that identity that doesn't involve substances. And particularly in a social context, like Jeff was talking about, or Dr. Kamlet was talking about with NA and AA. Integral to the process of recovery is reconnecting with the sense of self and others. And moving to a network that's supportive of recovery increases the likelihood of abstinence from other substances. So, similar to the Bwiti, Ibogaine treatment in the West has been found to help people kind of reconnect with themselves, with their concept of self and with others. And there's an Alan Davis and Barsulia Polanco study that looked at 73 patients and found significant persisting positive changes reported after Ibogaine treatment, including a sense of gratitude, the ability to be a more authentic person, a sense of meaning in life, increased sense of life being interconnected, better quality of relationships, importance of spirituality in life, sense of values, acceptance of others. The persisting effects of Ibogaine in other qualitative and quantitative studies have also been looked at. A really small study with only 22 patients also found long-term improvements in self-understanding, improvements in family and social relationships, increased engagement in academic and professional activities, and improved quality of life. As Dr. Brown was talking about in his study with Dr. Alper, they also quantitatively found improved outcomes in family and social relationships following Ibogaine treatment as well. And I think it's kind of important to talk about social connectedness and health in the West in kind of a broader context. So even outside of addictions, when you're looking at the West, social connectedness is associated with much better health. Adequate social connections improves the odds of survival by 50%, which is pretty huge. It can, help maintain healthy BMI, manage blood sugars, enhance cancer survival, alleviate depression, decrease PTSD, improve overall mental health. Social relationships and a sense of belonging enhance a sense of meaning in life. And people who are oriented towards intrinsic goals of close relationships, personal growth, self-understanding, and really contributing to community experience increased personal well-being. So, how does this really relate to the Bwiti? And probably the biggest lesson I took from witnessing all the initiations and the ceremonies in Gabon was the importance of this identity in community and connectedness. And I think when you're looking at addictions treatment, this is really important. And it applies not only kind of on an individual level, but also a larger cultural level in the West. And so, similar to the Bwiti initiations, the Ibogaine treatments appear to have these lasting effects of increasing, authentic sense of self, increased connectedness and interdependence with others. But when you're kind of looking at a larger cultural view, treating addictions may not just involve kind of looking at the individual and looking at personal changes, but kind of cultural changes in identity, community, and connectedness. And so while it's really unlikely that our culture is ever going to shift to a completely relational concept of self like the Bwiti, recovery from addiction on a cultural level may involve reversing some of the trends of increasing isolation and materialism and sort of shifting more towards a value system that's based in connectedness and community. And I'd like to end with another quote from Malidoma Somé, which is, "Every Westerner who visits my village leaves with one thing, and that is the experience of the intensity of the human connection and attention. It's not the magic, the ritual, or ceremonies that are done, but an awareness of the intensity of human connection that they take away. This is what makes them long to return again, because that is what they don't get here. What would it be like if that intensity of human connection could be found here in addition to all of the material wealth that is available? If the human wealth could match the material wealth, what would happen?" So, thank you.
A few minutes for Q&A for both Dr. Clark and Brown.
Yes, thank you for the lectures. Could you describe the Ibogaine sessions in the studies that Dr. Brown talked about? Are there any psychotherapeutic elements or ceremonial elements, and are there any meetings before or after the sessions?
Okay, so the first part of your question about there being some psychotherapeutic aspects of the treatment, no, or ritual elements, not explicitly. So there are no explicit psychotherapeutic or ritual elements of those treatments. And actually, Dr. Clark has a good sense of how these treatments are done as well.
Yeah, it's very dependent on where you go. It's very hit or miss at Ibogaine clinics. There really isn't a certain standard. So.
Know about the studies that you performed. What were the sessions like?
Okay, so typically, and this is, there were two different clinics that I worked with. In the first clinic, people would get to the clinic and they would usually be there for a few days, and they would have a nutritional regimen that was completely changed for them. They would be getting some body work, and they would be talking with the Ibogaine provider, and then they would have their treatment and sometimes would stay at the clinic for a few weeks afterwards. And that's unusual. The other treatment site that I worked with, and that's where 25 of the 30 people came from in the study, he would get people in and have them fly into San Diego from wherever they were and pick them up in San Diego, drive them across the border, and within a few hours of getting into the clinic, he'd be treating them. And then, 3 to 5 days later, maybe a week later, they'd be going back home. So very, very bare, pretty raw, no ceremony, no even discussion to manage expectations or to get someone ready for the treatment.
Okay, we have time for one, maybe another question here.
Thank you very much for interesting lectures. My question is, so I think one of the really big problems is there are a lot of false myths and misconceptions about psychedelics due to misportrayals in popular culture or not very ansvarsfulla representationer. Irresponsible representations through popular culture. And Ibogaine, I must say, I was not aware Ibogaine existed until like 2-3 days ago. And I think probably because it's hard, it's more expensive, it's hard to get, so it hasn't reached people as LSD and psilocybin mushrooms, other substances have. So those substances are already kind of done. You know, people have gotten an idea of what they are. You know, oh, why would someone take LSD? Oh, you know, maybe lunacy, or they're just kind of a crazy party person. But if I go onto the street and ask someone, why would someone take Ibogaine, I don't think they know what Ibogaine was. So this is a unique opportunity. You know, we have the opportunity to like control in a good way how this information reaches the public, and how the public idea of Ibogaine is shaped. So how do you think that is done in the best possible way?
Well, I don't know that we have that much control over it, honestly. I think that it's becoming more and more well known. When I first started doing research in 2009, it was much less, there was much less public awareness of Ibogaine in the US for sure, and globally than there is now. And you know, sometimes what people hear is, oh, someone died at an Ibogaine clinic. You know, that doesn't give someone a very good image of Ibogaine at all. And sometimes they might hear that someone was treated with Ibogaine and they stopped using heroin for the rest of their life. You know, and then that's obviously a really positive image. So I think we don't have a whole lot of control over what people get to hear about Ibogaine when they first hear about it.
Yeah, I think there's also a lot of kind of magic bullet ideas that are out there about Ibogaine that aren't very useful, and that it's not necessarily a magic bullet for addiction. But what it does is incredible. And so I think it's important not to exaggerate. I think that accuracy when you're looking at it is quite important.
We can take a minute. One last question, so we make a quick one.
Thank you. Great talk. So a lot of the patients that we see them in California, but a lot of our patients that are on opioids usually have started because of a chronic pain indication or after surgery or something like that. And there's an underlying issue that's not just simply, I took opioids before and I continue to take them. So I'm wondering, a couple questions, but I'll keep it simple for now, is have you tried Ibogaine with patients that have other underlying issues like chronic regional pain syndrome or anything like that, where there's an underlying indication for the opioids?
Yeah, well, you know, Ibogaine is used for all sorts of indications. I mean, I think a third of it is just psychospiritual use, and there are lots of people who are on opioids for chronic pain syndromes of some sort. I don't know about chronic regional pain syndrome, but there certainly haven't been studies of, you know, how effective that is to my knowledge.
Yes, I agree. There haven't been any studies that have been done on that. And to answer your question more directly, we actually, I didn't make this very clear, but in our studies, it was an observational study, and it was restricted people with opioid use disorder. And so that was one of the screening criteria, was if you came in with a cocaine habit or alcoholism, or were doing it for psychospiritual purposes, you weren't allowed to be in the study. So we were being specific so we could really focus in on that. So I'm not aware of any studies that were, and we didn't provide the treatment either. So we were just observing what happened after treatment.
Well, thank you so much, Dr. Clark, Dr. Brown. Big hands of applause.
Yeah. Thank you.